Ladies and gentlemen, I would like to welcome you on the educational video program of TensioMed Limited. My name is Miklós Ilyés. I'm the president of the Hungarian Society of Arterial Stiffness, and I have been using the Arteriograph method for 14 years. In the following, I would like to share my experiences how to install the Arteriograph device onto a patient to perform a measurement. Before starting with this technical procedure, I would like to tell you something why and how we have to prepare the patient for the examination. Because we are measuring physiological parameters, it is very important to keep some very important advices which we have to give to the patient before of the examination. The patient cannot drink alcoholic beverages 10 hours before of the examination. The patient cannot smoke, cannot drink caffeine or caffeine beverages 3 hours before of the examination. It is not good if the patient comes to the examination in fasting conditions. For this reason, a light meal should be eaten 2-3 hours before of the examination. Furthermore, the patient cannot move, cannot sleep, cannot talk during the examination. These are all very important parameters to follow them to be able to standardize the arterial function, arterial stiffness measurement. Now in the following, I would like to measure my kind patient. You are mostly welcome here. And I would like to show how to install the cuff. The device software will ask the cuff size, and then for this reason I will measure the arm circumference of the patient, which is in this case 29 centimeters. I have to type into the software 29, and then I will receive information from the software that I have to use the size, medium size cuff, and then this is prepared already. I have to put this size cuff on the patient and always has to put on the right arm. The cuff should be tight enough, which can be controlled that way that I cannot put my small finger under the cuff and between the skin. A long sleeve shirt should be used because in this case we can avoid the cuff dirtiness, and it is even more comfortable for the patient. It does not influence the accuracy of the measurement at all. The signal of the cuff showing the artery should look medially. The patient must be in calm. Please do not move, do not do anything. And the reason why we have to use the right arm, it is due to anatomical reasons. As we all know well, the right brachial artery originates from the right subclavian artery, and the right subclavian artery originates from the truncus brachiocephalicus, in the other name arteria anonyma. And the position of the arteria anonyma is closer to the root of the aorta. For this reason, in this case, we can measure a longal aortic part. Thus, it is extremely important because the first signal of the aortic calcification used to occur at the original and beginning part of the aorta. Now we are ready with the cuff installation. The cuff installed properly. We have a room temperature, which is important for the examination. It cannot be cold, cannot be warm, because all of these surroundings can influence the patient measurement and the characteristics. So again, the patient is not allowed to move and not allowed to talk. Let's start with the examination. Very few seconds and the device will be connected to the computer via Bluetooth. First, the device controls the zero pressure, and then it starts to pump up very soon the cuff. we can hear a gentle sound during the pressurization of the cuff. And then we achieved the so-called 170 or 60 mercury cuff pressure, and then the blood pressure measurement started. The device goes through on each cuff pressure, dropping the pressure in the cuff with 10 mercury. In the meantime, all of the received pressure curves are transmitted via Bluetooth real-time to the device computer. Having performed the standard blood pressure measurement, the device pumps back first to the diastolic measured cuff pressure, which is going on now. During this process, the device collects the so-called volumetric curves, which are important to determine the left coronary filling conditions. Now the device pumps up to the suprasystolic pressure, which is at least 30 or 40 mercury higher than the actual measured systolic blood pressure. The measurement is done. We have to measure the arterial function and arterial stiffness on the right arm due to anatomical reasons. Here in this picture we can see that the right brachial artery originates from the so-called truncus brachiocaphalicus, or the other name arteria anonyma. The arteria anonyma is closer to the aortic origin and aortic trunk than the left subclavian artery, which feeds the left brachial artery. This region, in this case, if we measure on the right arm, will be assessed as aortic pulse velocity and aortic stiffness. The importance of this region is that the very first signal of occurring the vascular calcification used to happen in this region. This is the reason why we do have to measure the arterial stiffness on the right arm.